Hello, I'm Chris Perrone, Deputy Director of the California Healthcare Foundation's Health Reform and Public Programs Initiative. Our foundation works as a catalyst to fulfill the promise of better healthcare for all Californians by supporting ideas and innovations that improve quality, increase efficiency, and lower the cost of care. Big changes are coming in the way Americans get and pay for their healthcare coverage. By 2014, the National Health Reform Law, known as the Patient Protection and Affordable Care Act, could help as many as 32 million Americans who have no health care today to receive coverage, and it will transform the way many others are covered. One of the ways this will happen is through the expansion of Medicaid coverage. Medicaid, which is funded jointly by federal and state governments, pays for care for those who can't afford it. It helps low-income children and their families, as well as many low-income individuals who are elderly or disabled with physical, sensory, developmental, or other impairments. By 2014, under health reform, Medicaid coverage, known as Medi-Cal in California, will be extended for the first time to all Californian citizens and legal residents with incomes up to 138% of the federal poverty level. This is equal to about $15,000 a year or less for a single person, or about $31,000 or less for a family of four. One of the main groups that will be newly covered is childless adults, who are not currently eligible for Medi-Cal, no matter how poor they are, unless they have a disability or need long-term care. Under health reform, this group will be eligible for Medi-Cal coverage for the first time. Enrolling in public health insurance programs in California has traditionally been challenging and complex for consumers. The health reform law requires a streamlined enrollment process for Medicaid and other public programs, and requires states to accommodate applications online, on paper, in person, and by phone. These new eligibility rules and the new enrollment systems being put into place in the coming years should dramatically simplify the processes for determining Medi-Cal eligibility. All of these changes will bring about a dramatic expansion in the number of Californians who have access to health insurance. These reforms are expected to increase by 2 to 3 million the number of Californians enrolled in Medi-Cal, which now serves nearly 7.5 million people, or roughly 1 in 5 Californians. This expected growth of Medi-Cal will place substantial stresses on the program. The state already faces severe budgetary constraints that make it impossible to support Medi-Cal at its current growth rate. Many enrollees also struggle to find doctors willing to accept Medi-Cal reimbursement rates, which are among the lowest in the nation. Under health reform, the federal government will pay for a 2-year increase in Medi-Cal reimbursement to primary care physicians, up to Medicare reimbursement levels. But many question whether this temporary increase will have any impact on physician participation in Medi-Cal or access to care. Moving forward, the success of health reform in California is linked to the stability of Medi-Cal as it prepares to enroll these large numbers of newly eligible people, while also providing access to and controlling the cost of care for both new and existing enrollees. The long-term viability of Medi-Cal requires innovative thinking, strong leadership, careful planning, and timely action. The changes to Medi-Cal that were approved in 2010 as part of California's federal Medicaid waiver, titled A Bridge to Reform, are a good first step, but much more innovation is needed. You can access more information about the Foundation's work in support of the implementation of health reform at chcf.org/health reform. I'm Chris Perrone from the California Healthcare Foundation. Thanks for watching.